Many of the patients who seek Ayurvedic eye treatment may have already been prescribed a surgical management. So, the question in the minds of patients is very clear. Should I go for a surgical management or a medicinal management? So, that is the topic that I would like to ask our chief physician to clarify.
First of all, we have to understand one thing. Ayurveda gives equal importance to surgery and medicinal trials. It is not a science where surgery is contraindicated. But nowadays, what happens in situations where medicine is possible or only medicinal trial is possible according to Ayurvedic theory, in such situations, some surgical interventions are prescribed by other systems. Here comes the toughness for the people, whether to select this medicinal Ayurvedic treatment or surgical interventions of the other systems. Now, that is the discretion of the doctor to handle it successfully, whether medicinal trial will give good result or not. But in my opinion, if there are two options, that means I am not talking about Ayurveda, allopathy, homeopathy, nothing like that, only two terms, surgery or other surgical, any type of mechanical interventions, and the medicinal trial, whether it is homeo, Ayurveda, whatever it may be. If there are two options, I will always advise to go for the medicinal trial first, because these medicinal trials are not making any mechanical or anatomical changes in the eye. Even though we are not getting the desired results in a medicinal trial, the option for surgery is still there. That is the one point. On the other hand, if there are two options and we are going for the surgical trial first and not getting the desired results, then the option for the medicinal trial is very, very less. Because in a surgical intervention or any other types of mechanical corrections, there will be a permanent change in the anatomical structure. Something is cut forever, something burned is burnt forever, something switched is switched for that is a permanent change, and in most cases it is irreversible. Then the medicine can be tried only that level only. That is the particular situation. So, we have to see, especially in Ayurvedic medicine, these medicines are formulated or proposed to act on the normal tissues of the body. It will give maximum result in the normal tissues. But after a surgical intervention, sometimes there will be implanting some artificial things. A stent is implanted, or the vitreous humor is removed, and then instead silicone fluid is done, and cauterization is done, photocoagulation is done. In such a situation, there will be an anatomical permanent change done on that particular structure. On that structures or on that points, the medicinal action will be comparatively less. So, I will always advise go for the medicinal trial first, and surgery can be opted where medicine fail. That is my personal opinion. This is applicable not only for eye disease, for any disease. So, because we can do surgery even after the medicinal trial, only if not getting the results. That is my advice always.